Hi there. Again, my name is Sunny Holmes. I'm a physical therapist at Ride On. This is the third part of the three-part series regarding cerebral palsy, Down syndrome, and autism spectrum disorder. Today, we'll be speaking about autism spectrum disorder in this PowerPoint. So our objectives today include understanding the basics of autism spectrum disorder, or ASD for short, understanding the challenges that people with ASD may face, possible treatment strategies for people with ASD in physical therapy settings, understand how a horse's movement could benefit someone with ASD, and understand what to focus on during an intake lesson. So before we get started, I know I spoke about this prior to the lecture on cerebral palsy, but just a reminder to always speak with people first language. I think that oftentimes people first language can get lost in speaking about people with autism. You might hear, autistic rider or autistic child. So let's just remind people to always use people first language. Another thing to think about is functional ability level. This is especially important with diagnoses such as autism or cerebral palsy, that we talk about their high functioning or low functioning. But instead of using that language, let's talk about something that they are able to do instead of things that they are unable to do, or talking or relating things to their cognition. So just a quick reminder before we get started. So what is autism spectrum disorder, or ASD? Autism spectrum disorder refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication. In 2013, the American Psychiatric Association merged 4 distinct autism diagnoses into one diagnosis, now known as autism spectrum disorder. So now it encompasses them all. The 4 diagnoses are Asperger's syndrome, autistic disorder, childhood disintegrative disorder, and pervasive developmental disorder, not otherwise specified. So according to the CDC, autism affects approximately 1 in 54 children in the United States. Let's talk about some of the indicators of autism. So the typical age range of diagnosis is about 2 to 3 years of age. Now, it is more prevalent in males than females. So typically the 2 to 3 year age diagnosis timeline is for males, and it can be a little bit more difficult for providers to diagnose a female with autism, just because they might not have those same indicators or indicate as strongly as males. So some of the indicators that we do see oftentimes are avoidance of eye contact, preference for solitude, delayed language development, echolalia, which is the persistent repetition of words or phrases. They really do prefer routines and repetitive behavior. So you might see hand flapping, rocking, or spinning, and this has to do a little bit with the sensory needs that they are seeking or avoiding. You might also see unusual and intense reactions to sounds, smells, tastes, textures, lights, and or colors. And occasionally they will have difficulty with displaying empathy. So before we move on to a discussion, I wanted to talk about a few other things, such as causes and risk factors for autism. So most scientists do agree that genetics is one risk factor for people with autism. And parental age also does play a small role in that. Children of older parents are at a greater risk of having autism spectrum disorder. And they do believe that some prescription drugs out there do lead to a higher incidence of autism. And again, like I said earlier, it is more common among boys than girls, and that is 4 times more common among boys than girls for being diagnosed with autism. So now let's move on to our discussion as we've done with our other 2 PowerPoints. So for this, think about your current clients with autism, and I want you to think about the challenges that your riders with autism have faced, whether that's in their daily life, socially, or physically, or also with you during your writing lessons. So things like the routine. Do you always use the same horse? Do you always use the same tack? And I assume that for most of you, the instructor will be pretty much the same from lesson to lesson unless there's coverage needed for one instructor. And thinking about changes in lesson plans as well. So when you establish a routine, how does your rider with autism react if maybe the horse is lame that week, or the saddle broke down and no longer fits and you need to try a new one? What is that reaction like? And how do you think that kind of plays into the lesson going forward? Again, with the sensory processing difficulties, do you see any of this occurring during your lessons? Are you seeing more rocking or hand flapping? Or are you seeing that if you maybe trot the long side too much, that you're seeing them kind of break down and not have a great ending to their lesson? Maybe that's too much sensory information for them. And then as far as the intake lesson, do you feel like you do anything different with your clients with autism compared to your other riders? And do you find that helmets are an issue, especially during the intake lesson? And what are some things that you have done in order to help them overcome maybe some of the sensory issues with putting a helmet on? And, you know, in the current times, do they have difficulty wearing their mask if they're required to? That can be another issue that we have come across specifically. And overall, what adaptations have you made for them? So just thinking about all these things, I think can really help you with your lessons and intake lesson, definitely, for your riders with autism. So now let's go into possible treatment strategies for a physical therapy setting. So myself as a physical therapist, these are the things I'm looking to address during treatment sessions. And then we can talk about how they will kind of roll into, you know, a riding lesson and use of that equine movement and how they can overlap. So I'm looking at things like strengthening, that postural control and endurance, range of motion if they have difficulties there, gait training if they have difficulties there. Oftentimes people with autism, you'll see them walking on their toes, and that could be due to a multitude of things, one being sensory difficulties with feeling the entire shoe or sock or walking surface on the bottom of their foot. I also go over parent education, orthotic management. We talked about that during the lecture on cerebral palsy, that's very important to monitor. If they do have, if they do demonstrate toe walking, then potentially they might have orthotics. Talking about motor planning, so how to get from point A to point B successfully and how to plan that out, and motor control, so being able to grade your movements appropriately. So let's talk about how autism spectrum disorder and equine movement go into play together. Oops. So we have potential sensory seeking or sensory avoidant behaviors. So sensory seeking behaviors are going to be the hand flapping, the rocking, the bouncing, the jumping. They're trying to get some kind of sensory information to their body that they are not able to get otherwise. And then again, sensory avoidant behaviors. Could be tactile as well. So if they are, petting the horse, or if you want them to pet the horse and they are avoiding that behavior, that could be due to a sensory issue. Same as what I mentioned earlier, if you're trotting this long side and you feel like, the end of your lesson really went downhill, that could be overstimulating for them, and you'd want to avoid that next time. And then they might want that increase in proprioceptive input, and which they're going to get from the horse. And they may need to, you may need to increase or decrease that depending on the rider that you have. So that proprioceptive input really comes into play with that vertical displacement from the horse's movement. You're also going to get an increase in vestibular input just because the horse is moving through space, and that's challenging their inner ear equilibrium and balance. Again, the horse's movement is low impact and repetitive, so that repetition could be calming for them. And again, motor sequencing. So this is the same as motor planning, so how to get from point A to point B, or A to Z with, E through Y in between. So this can be really important during your lesson if you're having them go over ground poles or go through an obstacle course, say weave through the poles first, then go over ground poles, then do a 10-meter circle. So they have to think about the planning portion of each of those steps in order to get from the beginning to the end. And of course, equine movement always challenges postural control and endurance. So during your intake lesson, just some things to keep in mind are going to be potential difficulties with sensory processing. So putting that helmet on for the first time. Some of the things that I've done for my patients on the therapy side are to instruct the families to practice ahead of time before they get there, or after the initial treatment session during therapy. Then I will have them practice at home, and everybody wears a helmet, and I know that some of our riding instructors do this as well for their riders. Again, masks can be an issue right now, and input from the horse and your horse choice. So if you're seeing some sensory seeking behavior, maybe you're thinking about changing your horse during your intake lesson, and you might need a horse who provides more vertical displacement than you were initially thinking, or maybe along the way, maybe not during your intake lesson you do that, but maybe 2 lessons in, you look for a horse change if they need that extra input, and vice versa. If you feel like during your intake lesson they got too much sensory input, then you could potentially be looking to downgrade that input with a horse that does not provide as much displacement. Again, thinking about a routine, if that's helpful, you can always ask them or ask their family members if that's something that is helpful for them. What do we do when we first get here? Okay, we go, and right now, of course, we're doing, temperature checks and COVID questionnaire, and then we go wash hands, and then after that, then they clip their reins on, then they go to the mounting block, and then we get on from there. So just keeping that routine in mind could be helpful for some of your riders, and to challenge their ability to sequence correctly. So if you find that one of your riders is having difficulty remembering a 2-step direction, that is their limit, and you don't want to move on to something that is a 3 or 4-step direction before they're able to tackle a simple 2-step direction first. And their processing time, oftentimes people with autism might have a little bit of a longer processing time, and sometimes they do not. So just keeping this in mind when you're asking them to do something, especially if it's a person that struggles with motor planning or motor sequencing, and you just ask them to do a 3-step direction, it might take them some time to process that information. So just be cognizant of that to give them the appropriate amount of time. You might have an issue with elopement, so always ask if it is a younger rider, if they are going to run away during the lesson, just for safety issues. And always ask if there's any history of self-injurious behavior, such as head hitting or head slapping or face slapping. And then you can watch out for this during your lesson, and also maybe talk to the caregiver about ways to combat this during a lesson if it does happen. And you want to think about visual scanning. So because people with autism often avoid eye contact, they may not scan their environment appropriately. So this can be one of the things that you could potentially work on during your lessons, is to have them visually scan the arena, look for a certain color cone or ground pole or something on the outside of the arena perimeter. Just something to think about to have them work on. And of course, if there are any questions, like I said previously, please submit them ahead of time and I'll be able to answer them on our Q&A day. All right, thank you for listening.